So this is a presentation for a National Institute for Health Research workshop in November 2019 on the theme of tick-borne infections and research and knowledge gaps. My name is Kate Bloor. I'm from Lymeresearchuk, a community group, and these are my areas of expertise, which include, in the past, having studied human sciences, the sociology of health and illness, the sociology of science and technology and policy, etc. So this presentation is about 15 minutes long and explains the 5 research priorities that I've put forward to this workshop. So the first research proposal is to do with exploring the current practices and knowledge of medical professionals in different specialties related to Lyme disease. 2 sub-questions are: what is the value of a dedicated Lyme disease clinic, and what are their training needs and how best can these be met? So to explore that in a little bit more detail, medical professionals and researchers as well may have very different beliefs and understandings of acute and chronic Lyme disease, and it would be useful to know what these attitudes, experiences and beliefs were in clinicians, and how this related to different stages of Lyme disease perhaps, and what this meant in terms of their training needs. This also could tie in with an understanding of what the benefits and acceptability and the need for a Lyme disease clinic nationally is currently, since this has been suggested many times by patient groups. My second research priority is what are the range of mental health symptoms related to Lyme disease, and a related question in light of that, which is what kinds of services would best meet these needs. So to expand on this theme a little more, we need a full review of existing literature related to mental health issues, including psychological and psychiatric manifestations of Lyme disease during different stages, and also in relation to post-treatment. We need to understand patients' experiences of these symptoms, since they may have more complex manifestations, and in particular how the services that are available relate to this and how well their needs are being met. The third theme is obviously an area that many different researchers and Lyme groups, patient groups are interested in, which of course is about laboratory tests that are used to diagnose initial and ongoing infection at different stages of Lyme disease. And I'd like to throw in the particular issue of investigations related to diagnostic procedures around reinfection for the different presentations of Lyme disease in the UK. To expand on that in a little more detail, this sort of investigation should address the performance of tests in non-acute cases of Lyme disease, looking at why they might perform differently and what the implications for diagnosis might be. I don't believe this kind of investigation has been done before. In addition, we need a review of basic and clinical research addressing the accuracy and efficacy of testing in non-typical cases and later manifestations of the disease. And we also need to take into account active disease and instances of treatment failure. My fourth research suggestion covers an area that Lyme Disease UK has already done some work in, which is what is and are the lived experiences of people in the UK diagnosed with Lyme disease in terms of accessing diagnosis and their also treatment and so on, and what are the implications of this for existing statutory and non-statutory policy and practice. To expand on that in a little more detail, what would the benefits of examining experiences of Lyme patients' access to health services and for those diagnosed with Lyme disease? Well, it's important to understand the needs of people in the treatment and diagnostic pathways that we currently have, since this would enable better improvements and developments of those pathways and how they're implemented at different levels of the health service and so on. But it also might impact on grand policy and practice in relation to statutory approaches. It could highlight what the needs are for a dedicated Lyme disease clinic nationally from a patient's perspective, and it would enable information and advice to be designed for those at risk of this condition, taking these kinds of issues into consideration. So my fifth priority is probably the most unusual in terms of research, since it's very much based within the social sciences paradigm, and it's about looking at shared decision making as a potentially useful approach within the context of the more complex clinical cases of Lyme disease and this uncertainty around how to treat those cases. And some related questions are: can patient and clinical interactions and treatment outcomes be enhanced using this approach? And can clinicians using this approach achieve better real-world outcomes? So to expand on that a little more detail, this is looking at the role of shared decision-making in Lyme disease, particularly in relation to chronic illness. It's about how decision-making of this kind can be used with patients in this situation. It can be a prospective study which involves training of clinicians and monitoring their experience and patients' experiences and how this affected long-term clinical or non-clinical outcomes. So this could also focus on patient-centered outcomes, clinicians' experiences, quantitative and qualitative measures, for instance, quality of life, levels of satisfaction, and specific physical outcomes as well, if necessary.